So advanced directives are tools that can help us. They're not perfect, but they allow a patient to designate, here are things generally how I would like here are ways that I would like my care to go if for some reason I became unable to make decisions in a particular situation. Most states now have something called the POLST, which is where we sign an order and the patient makes designations about whether they want acute resuscitation, whether they would want aggressive treatments, including intubation, whether they would want tube feedings. And there are some more extensive versions of this. Keep in mind that these don't require lawyers, they don't require any notaries, they require the patient and you and a witness, and that's it. Durable power of attorney, make sure it's for healthcare. Some people come in saying I'm the DPOA, and that's for their finances, but not for their healthcare. So it has to be for healthcare. And then that person becomes the legal surrogate, proxy, or decision maker. And their decisions supersede the living will, supersede other family members if they've been designated as the DPOA for healthcare. We obviously want them to take into account what the patient has said on their living will because that's the spirit of it. But it's ultimately that DPOA's decision as if they were the patient. Palliative care is a discipline that helps us talk about helping patients when they've got a very serious illness. Most often we think about this in terms of cancer, but we should be thinking about it for any serious or incapacitating illness. It really emphasizes use of home care over hospitalization, relief of symptoms over cure of the disease. Palliative care has been shown to reduce mortality. So getting palliative care involved early, even if the patient says, yeah, I've got a cancer and I want to go forth and with the treatments they're suggesting, palliative care referral so that they're involved with each step of the process. Hospice is really the end stage of that palliative care cycle for patients with less than 6 months to go.